Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at JointRehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and the number here in the studio for you to give us a call and talk about what's going on with your pain is 866-870-5752. That's 866-870-5752, and we're talking about basically orthopedic pain today. And the website is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and see him performing the treatments on videos. And right now we are speaking with Mary in Temple City.
Hey, Mary, I just want to have you sit tight for a second while I go over your case a little bit for new listeners after this break. So Mary has, it's a great story that you actually have here to teach people about regenerative medicine, Mary. And regenerative medicine is injection of cells from your body. PRP is platelet-rich plasma. It's using your blood. And stem cells can come from your bone marrow or other places. And those are things that we use to regrow tissue in the body and help it heal. I only do orthopedics, okay? That's musculoskeletal things like ligaments, tendons, joints, arthritis, anywhere from really the back of the head all the way down to the bottom of the feet, everything in between. And what you might say, the white horse that I ride, and I've done for over 20 years, is, since my residency at UCLA, is to save people from getting surgeries, because most of these little surgeries are unnecessary. Don't kill the messenger. It's the truth. I know a lot of doctors don't like what I do, cuts into their line of work called surgery, but I find that most of the people that to see me who have had a surgery have had a failure. That means there's something wrong with that picture. If it doesn't come out well, why do you want to get one? And I don't understand, and this is not surgeon bashing, please understand me. I love surgeons. They do the hardest work in medicine. I take off my hat to them. But the problem is, what they're doing in orthopedics is being overdone. Their tradition is on its way out, and regenerative medicine is coming in instead. I was lucky enough to learn about it while I was at UCLA. We had a 1-hour lecture on it, and I went to the doctor's office. I listened to his patients. I mean, it was funny. He came in, and the first thing he said is, I heal 90% of my patients with regenerative medicine. No one believed him. Everybody started laughing, and I went with him to his office. I talked to his patients, and they were talking about him like he was God. So I did that work on my own body. The first part was my wrist, which had been injured for years, and I'd been in a lot of pain. And overnight, with one series of injections, I was 50% better. Then I did my shoulder. That was 100% better overnight. I've had other areas that have taken a long time to heal. Sometimes it's like that. But the thing is, your setup here looks like if I were a surgeon that I would operate on your, because you have back pain and you have in the back of your leg. But I am going to bet you anything, if you come in and I examine you, I will tell you it is not from your back that the pain down your leg is coming from. In the back of your knee, and you have pain at the bottom of your buttocks. And those are two separate areas that can be healed up with regenerative medicine. And in the low back, the same issue. So be very careful, Mary, that you don't run to a surgeon before you run to regenerative medicine. You got to have someone with lots of experience. And I tell everybody this. People come to me for referrals for all different types of disease states. And I always tell them, go to the doctor who does the most. And you always want to have a doctor who does the most of anything. I'm fortunate because I've been doing this for over 20 years. I think I do the most and have done the most of anybody alive. I'm not sure, but that's what I'm told. And I think I have the experience to figure out if these problems that people have are coming from a surgical issue or a regenerative medicine issue. They're different. Sometimes if it's a surgical issue, you can still heal it with regenerative medicine, just a few injections where you walk into the office, get injected, and walk out instead of having any kind of side effects that you get with surgery. I mean, let's face it. We all know people that have had surgeries and had terrible problems. I've been in the operating room with people who've died on the table. So I'm not for surgery, and the failed surgery on my shoulder taught me a good lesson, and it made me jump over to doing regenerative medicine. So, Mary, I want to get back to your last question here. You said, until you come in the office, are there any other modalities that you can do? First of all, because you called the show, if you want to come into the office Monday morning, I'll get you in. Anyone who's listened to the show, if you need to get an appointment, I'll get you in immediately. Just say you listen to the show and you want an appointment immediately, and I'm going to give you my cell number, Mary. It's 310-666-9977, and if you want to call me after the show and get an appointment, I will set you up and I will fit you in, okay? So other modalities that you can use for all this stuff, got so many possible things going on that you need to be examined to figure out what it is.
Okay.
I mean, I'm not saying I'm the only guy that can fix you. But what I am saying is you need somebody that can figure out what is going on here. You don't want to get to the wrong doctor who's going to want to operate on you because you're a setup for surgery with the way you're describing this, and I don't think you're going to need surgery. So be careful.
Thank you. Yeah. Well, okay. I just, it is getting to be a real bother where I cannot stand too long. And then as soon as I sit down, it's gone. So, I don't know. Okay, yes, I thank you very much. I appreciate what you're saying, and I agree 100%. I know nothing about medicine, but I agree with you 100%.
You always want to be conservative. That's the bottom line in medicine. Mm-hmm. You know, the first law of medicine is do no harm.
Right.
And unfortunately, I'm not, again, I have to be careful because I'm not here to make surgeons mad at me. I think they're the smartest guys in medicine. They do the hardest work. They have all kinds of side effects that come out of it that they have to deal with. But the surgery should not be done if you can heal a person with regenerative medicine of just injections with their own body cells. Makes no sense to me. Why someone's going to... It just makes sense. And it always made sense to me ever since medical school. It just clicked. And it healed me.
Right.
You know, I've self-injected myself over the last 20 plus years whenever I've injured myself. And unfortunately, I'm that athlete that does things pretty hard to the limits. So I do get injured, and I'm going to be 72 in July, but I'm still working out hard. I feel like I'm 16 years old.
Oh, how wonderful! That sounds great.
No, it's true.
Okay.
I stay in great shape. and I'm about 6 feet, 170 pounds, so I stay skinny on purpose.
Mm-hmm.
And it helps. All that stuff helps.
I'm sure it does, yes. Okay, yeah, you've definitely, well, you really didn't have to convince me, because that was the reason I called. Because this is, it just makes sense, that's all. It just makes sense.
One of the sad things is with student athletes, young athletes, they all want to have a surgery. Do you want to know why?
Why? Well,
because they watch the pros get surgery and their friends have had surgery. The team doctors are typically surgeons, so they think it's cool to be part of that, and then they end up with a joint that's destroyed afterwards.
Mm-hmm. Mm-hmm. Well, I tell you, if I had a choice, I definitely would not want to put my body through that much trauma. And it is.
No, you don't.
Not just physically, but mentally. So
you got it.
Definitely, that would not be my choice.
You got it. Well, we're on the same team here.
Great. Okay, Dr. Darrow, I appreciate your time and your knowledge here. I picked up a lot of good things to think about.
Appreciate it, and I'm sure all the other listeners appreciate you calling in.
Thank you, Mary.
All right.
Thank you, Mary.
Okay, our number here at the studio, 866-870-5752. That's 866-870-5752. Dr. Darrow's website is www.lastemcells.com. That's lastemcells.com. You can email him off of every page on the site and watch him performing the treatments on videos. It's amazing. When you call the program today, you get Dr. Darrow's latest book for free. Stem Cell and Platelet Therapy is the title. Regenerate, Don't Operate is the subtitle. It's got 264 scientific studies, and the foreword is written by Suzanne Summers, and all kinds of great information in that book. And again, our topic today is orthopedics. That's musculoskeletal pain, arthritis pain, muscle pain, joint pain, anything like that. So give us a call. We have lines open and some time left for you at 866-870-5752 right here at the studio.
So I'm going to take another question here because it's something people don't think about as much. When we think about injuries and all, we think about the knee first. Shoulders are probably next, and back pain. But this one says finger. So let me see what the person writes. This person says, I believe I have tenosing tenosynovitis. The ring finger of my right hand is painful. I cannot completely, and sometimes it locks in a bent position. Does your procedure alleviate this condition? So, you probably all heard of a trigger finger, and it looks like his ring finger may have that, but because he can't bend it, it might just be arthritis that he's talking about. So again, he needs an examination to see what's going on with this. We do treat fingers every day, toes, ankles, knees, hips, backs, necks, you name it. I get a lot of people with plantar fasciitis, which is on the bottom of the foot. So at any rate, we treat fingers, and there are so many people as they age that end up with arthritis in their hands from overuse. I get a lot of guitar players and violinists, a lot of people who are gardeners. You'd be surprised the type of things that cause finger arthritis. I get a lot of postmen, people that are flipping letters all day long. And so it's something I'd need to see. Again, I can't diagnose this over the radio, but it's something that generally we can help heal up. And let me see what else I wrote back. So, no, there wasn't a response after my email back. So, yeah, I don't really care what part of the body it is. I don't treat things like cancer or cancer pain. I can give you referrals for doctors that do that, or any other type of doctors that you need. I can give you referrals for. But, I treat the musculoskeletal system, what we call orthopedics, and I do it without surgery. And we do it by just injecting the area and stimulating the tissue to grow back and heal again. So we basically rejuvenate the body. Anything for you, Nita, before I take another question?
Yes, I'd like to just let people know that we have lines open for you at 866-870-5752 here in the studio. That's 866-870-5752. And we are here Saturdays. That's Saturdays at 10 a.m. and again at 1 p.m. It's all yours.
So this question just says hormone booklet. Let me open this up. Please email me or mail me information on hormone replacement therapy. Pretty simple when you do it all day long. And I treat this as an ancillary part to the orthopedics, because when people have their hormones balanced, often it'll help heal their musculoskeletal system. We know that when the hormones are in decrease, we lose bone density. So that happens right around the age of 27. And people don't think about this much because we're living so long. I see people who come in the office who are 100 years old now. If it was a couple thousand years ago or so, people were dying from infection and trauma. There was a lot of fighting going on back then all over the place. And so, how long did they live? 30? 30 would be a good age. And one of the reasons is because when the hormones drop out, the body is not regenerating itself. It goes into a state of decrease rather than increase. And when we're young and we're growing, our hormones are super, super high. So one of the things I like to do with patients is to check their hormones. It's an easy blood draw, send it to the lab, and we check things like estrogen, progesterone, testosterone. And we need this for males and females. Oftentimes, women lose their progesterone and then their testosterone very young, typically when they have a baby or sometimes when they get married, believe it or not. All those hormones just drop out. And then the husband is going, honey, come on to bed. And the woman's going, sorry, I have a headache. Well, it's not the headache. It's the headache of having to go through the episodes of sex without the sex hormones there. So that's something that can be tuned up very easily. Men have it in the same way. They don't have a menopause, so to speak, like women do. They have what we call andropause. And what happens to them is, believe it or not, men get osteoporosis the same way as women do. And their sex drive is down. They get erectile dysfunction. The muscles start decreasing, men and women, and the fat starts growing in there in place of it. So by replacing the hormones, and I'm not talking about doing bodybuilder levels, we're not allowed to do that, but just to bring you to a physiologic state of health, we can balance the hormones, and it's a great adjunct to the work that I do with orthopedics. They go hand in hand together. So yes, that's something that I like to do. There is a website I have about it, which is MyAgeMD, www.myagemd.com. A lot of doctors call it anti-aging. It's not really anti-aging. The only thing we know about for sure about extending life is being skinny, eating a low-carb. We know that that actually extends the number of years we're on the planet. If someone puts themselves into type 2 diabetes, which is just basically eating too many carbs, there are studies that show you live 8 to 10 years less. So that's pretty informative. I mean, that's pretty amazing.
Definitely.
So I do use that with my patients who want to do that. And there is a hormone booklet. I'm going to show it to the video camera right now. You can't see it, Nita. But there's a booklet that we have that we can give away also. And it's an ebook if you want to get a copy of it. By going to the website, which is www.lastemcells.com. lastemcells.com. There is a spot on every single page where you can email me, and we'll send you out a free copy of my book on stem cells and platelets and how to heal your body with that, and then age management medicine. I call it age management because we want to feel good until we leave the planet. You know, we want to feel good. We want to manage our age. Are you really going to live longer? Basically, only if you cut out your carbs and stay thin. That's the only thing I know about. But we can make you feel better, even if you don't want to lose the weight you need to do.
Sounds good. I like it.
Shall I take another question, or do you have stuff to talk about?
And I do have that age management pamphlet because you sent it to me a long time ago. So I know what you're talking about. Just
good.
Yeah, go ahead.
So here's another area of the body. It's called elbow. We all have a couple of those, hopefully. This person writes, I've dislocated my elbow when I was in high school. I'm now 56 years old, and my elbow has been bothering me for the last 5 years. It's getting a lot worse as I get older. So even though the elbow is small, it's complex like every other part of the body. And there are a bunch of different ligaments around it, like the annular ligament. There are tendons, the extensor and flexor tendons. And then there's the inside of it, which is the joint. And I'd have to actually touch your elbow, sir, and find out where the pain is coming from. So if you had an MRI or an X-ray and it shows arthritis, it may have arthritis, but that doesn't mean that that's where the pain is being generated from. So we have to find the pain generator before we treat to do a good job. Let's say you have arthritis in your elbow, but it's not the pain generator, and we treat the arthritis, you're not going to feel better. That makes sense? And what if it says, what if the MRI says that you have a little tendon tear in your elbow, but it's really arthritis that's causing the pain? Well, then we have to treat the arthritis and inject into the joint. Nice thing about elbows is we can use a 30-gauge needle, which is like an acupuncture needle, to push the solution through, in this case, which would be your platelets or stem cells. And it's basically a injection. I use the thinnest needles that any doctor can use so that it's not painful. Yeah, I mean, why hurt somebody if you don't have to? Some of the injections can get touchy. We use a freezing spray to numb up the area with that. And the show is over. Nita, thank you so much. You're a great host.
Thank you, Dr.
God
Darrow.
bless you, everybody, and thank you for listening.
Alex, thank you, Suzette. Thank you, callers and listeners. Grab a pen or a pencil, write down this important information coming your way, and remember to listen to The Pet Show with Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valance, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.